How much do we know about the institution responsible for the overall health and welfare of every single member of our society?
That's what we're dreaming of. We're dreaming of a sector that is well resourced in terms of human resources, that we have all the doctors that we need, all the pharmacists, all the nurses, and we have all the equipments that are required for taking care of anyone. So that's really our dream in the long term.
The mandate of the Ministry of Health and Social Services, MOHSS, is derived from Article 95 of the Namibian Constitution, which emphasizes the adoption of policies and the enactment of legislations to ensure the health and strength of Namibians. Drawing from the supreme law of the country, the ministry's mandate is to provide and protect the health of the Namibian people and provide quality social services to all, especially the weak and vulnerable members of society. Among the functions of the Ministry of Health and Social Services are to create an enabling environment to provide quality healthcare and social services for the attainment of the national policies, legislations, and development plans of our country, including Vision 2030 and the Harambee Prosperity Plan. The ministry continuously develops the capacity required for health planning and social services and maintains a database of the information necessary for making policy decisions. Other areas of responsibility within the ministry's portfolio include health promotion, public health, curative services, specialized health services, hospital services, health centers, clinics and health posts, outreach, standard setting and quality assurance, healthcare engineering, research and development, epidemiology, health infrastructure development, emergency response, institutional development, social services, pharmaceutical services and the development of pharmaceutical supply chain management, diagnostic and laboratory services, corporate governance, development cooperation, biosafety, and environment and health. Our work in fulfilling our constitutional duty is underpinned by the commitment of our leadership, management, and staff to our grand and noble vision to be the leading provider of quality healthcare and social services in Africa. To achieve this, we endeavor to implement our mission to provide integrated, affordable, accessible, quality health and social services that are responsive to the needs of the population. We at the Ministry of Health and Social Services are fully committed to living our core values every day. These values are confidentiality. We keep our patient information confidential and use it only for the purpose of treatment, unless legally obligated to do otherwise. Empathy and caring. We strive to treat others as one would expect to be treated and provide care and support to clients as though they are members of our own families. Transparency and accountability. We strive to be truthful and open to our clients in all our endeavors. Honesty, integrity, and dignity. All our patients and clients are treated with respect at all times. This includes having their values, culture, religion, and dignity respected. As ministry employees, we are truthful to ourselves, to the public, and show steadfast adherence to a strict moral and ethical code of conduct. Impartiality. We treat all our clients and colleagues equally, irrespective of their status, religion, political beliefs, race, color, gender, and sexuality. Professionalism. We conduct ourselves according to the ethics of our profession. Respect. We show regard for our clients and colleagues. Innovation and creativity. We strive to promote innovation, new ideas, and creativity in all our endeavors so as to enhance the efficiency and effectiveness of our healthcare programs. Customer focus. Our customer satisfaction is our priority.
Hi, my name is Nesta Kapofi. I'm a medical scientist, medical virologist at Namibia Institute of Pathology, and I'm from the Department of Molecular Diagnostics Unit, where we test for viral loads and HIV DNA PCR. And the reason why I'm here is to offer services, medical laboratory services, to the Ministry of Health, and not only the Ministry of Health, and also to the public and private doctors at large.
Today my name is Roxanne Furi. I'm a medical technologist. I work at Namibia Institute of Pathology. I chose this field because I enjoy helping patients and doctors achieve the best clinical outcome for their patients.
I am registered nurse Raunanda Tewapo. I'm giving nursing care to the cancer patients in radiation oncology. Those who are going to the machine and those who are going to the doctors.
I'm taking care of those ones who are going to the radiotherapy machine, and I love my job. I love taking care of sick people. I love my people.
For me, there is nothing more convincing and making you feel happy than seeing, for example, a patient coming in very sick in a wheelchair. You give the treatment, and after a week or two, that patient stands up and start working and feeling better, or coming back maybe years for follow-up after having been treated. That makes me very happy.
The Ministry of Health and Social Services is managed by a competent and dedicated leadership team, headed by the Minister with the support of the Deputy Minister, Permanent Secretary, and Deputy Permanent Secretaries.
We're really imagining ourselves as being a reliable, trusted, competitive sector in the Namibian environment. What do I mean by that? We want people to regain confidence in our sector. We want a reliable and quality, affordable public healthcare services provided by the ministry. So we want to be competitive internationally, so that whether you are involved in an accident somewhere there or you have some chronic diseases, you can get these services from our public institution without any constraint, and almost in the same way like anywhere else.
At a national level, the Ministry of Health and Social Services is composed of 3 main departments under the Office of the Permanent Secretary. Each department is run by a Deputy Permanent Secretary. The 3 key departments are the Department of Healthcare Services, the Department of Social Services, Policy Development and Resource Management, and the Department of Regional Health and Social Welfare. Under each department are various directorates responsible for overseeing a number of important healthcare programs. Each directorate is run by a director. The directorates at national level encompass the policymakers responsible for setting up the standards, guidelines, and quality assurance for the Ministry of Health and Social Services, and providing support to head office and the region by mobilizing and allocating resources for all the activities required to fulfill the ministry's mandate. Directorates falling under the Department of Healthcare and Social Services include the Directorate for Primary Healthcare, the Directorate for Social Welfare Services, the Directorate for the Tertiary Healthcare and Clinical Support Services, the Directorate for Health Information and Research, and the Directorate for Special Programs. 3 directorates fall under the Department of Social Services, Policy Development and Resource Management. These are the Directorate of Finance and Logistics, the Directorate of Human Resource Management and General Services, and the Directorate of Policy Planning and Human Resource Development. The Department of Regional Health and Social Welfare Services supports and oversees the operations of all the regional directorates across the country, in collaboration with the Department of Health and Social Welfare Policy and the Department of Policy Development and Resource Management. The Department of Regional Health and Social Welfare Services is an expanded directorate that includes all disciplines required to support operations on a regional level, up to the district and facility levels within each of the 14 regions. In this regard, the regional directorates also host their own human resource, finance, and administration capabilities, which are supported by the relevant directorates on the national level. In this regard, the Ministry of Health and Social Services has regional health directorates located in all 14 regions of Namibia, namely the Karas, Hardap, Khomas, Omaheke, Oshodonjupa, Zambezi, Kavango East and West, Ohangwena, Oshikoto, Oshana, Omusati, Kunene, and the Irongo regions. Within these regions, the Ministry of Health and Social Services also operates 35 health district offices in Namibia, falling under each regional health directorate. The district offices are the geographical health clusters of the communities and the coordinating body for the services the ministry offers. The majority of regions have approximately 3 districts. However, some regions may have more or less districts depending on the size, population, and the level of the development of the region. Each district hosts a district hospital. For example, Katima Mulilo is a district under the Zambezi Regional Directorate. As such, Katima Mulilo's hospital, healthcare centers, and clinics all fall under the Katima Mulilo district. District hospitals are run by district health management teams or district coordinating committees, who also offer small-scale primary healthcare services, clinics, and health centers to the various communities they serve. In terms of staffing, each district has a senior medical officer who is in charge of the district hospital. He or she is also called the District Coordinating Committee or DCC chairperson. This is the highest ranking official at district level. The other core members of the DCC team include the primary healthcare supervisor, who is responsible for the supervision of the primary healthcare facilities and services in the district, and the nurse manager, who supervises the nursing, care, and patient services of the district hospital. Other core functions include the environmental officer, responsible for the environmental healthcare services in the district, the social worker, and the senior administrative officer, who is responsible for all the logistics needed for the operations of the healthcare facility. The administrative officer manages the transport, fleet of ambulances, catering, cleaning services, general logistics, and revenue collection. The DCC team members all head up divisions with teams of staff under them. The district hospitals are complemented by various health centers, which comprise approximately 10% of the ministry's district health facilities in Namibia. A health center is a healthy facility with larger and more specialized services than can be provided at a clinic. The staff complement is also upgraded when compared to clinics and can accommodate medical officers, commonly known to the general public as doctors. Clinics, on the other hand, provide basic primary health care services and are all run by nurses with no doctor. Every district has several clinics which compose of the majority of the ministry's healthcare facilities in Namibia, providing the largest geographical coverage. In order to effectively manage and coordinate all its healthcare facilities, services, and infrastructure, the Ministry of Health and Social Services has implemented a national referral policy. The referral system guidelines facilitate timely referral of patients from one level of healthcare to another and are therefore important for the public to understand and make effective use of when seeking treatment. To prevent the hospitals from becoming overwhelmed by patients, basic services for minor ailments can be sought by community members first at clinics or health centers, if available. Referrals can then be made to district hospitals for more serious cases. Patients with specific cases from district hospitals can be referred to the referral hospitals, where specialized services such as gynecology, oncology, pediatrics, and internal medicine can be provided. Referral hospitals exist because all of the district hospitals cannot be equipped with specialists and specialized services, although the ministry is continuously engaged with the upscaling of its hospitals. Namibia currently has 4 referral hospitals in Rundu, Oshakati, Katutura, and Windhoek Central Hospital. However, additional hospitals have been earmarked for upgrading to referral hospitals. The Ministry of Health and Social Services is a multi-faced institution responsible for a critical constitutional pillar of our society. We continue in our tireless endeavor to create an enabling environment to provide quality healthcare and social services for the attainment of our national policies and development plans, including Vision 2030 and the Harambee Prosperity Plan. Our leadership, management, and staff is fully committed to executing our constitutional mandate through rigorously focusing on the institution's vision, mission, and core value. This dedication and focus will ensure that the ministry will continue to provide integrated, affordable, accessible, quality healthcare and social services responsive to the needs of the population for this generation and the generations to come.